Uterine fibroid embolization, known as UAE or UFE, or fibroid embolization, are different terms you'll hear this procedure called. So this is performed by interventional radiologists. We are minimally invasive physicians who perform these targeted therapies, and we actually do these treatments, and I'll show you through some pictures in a little bit, through little tiny holes that we can make in the skin, and in this case we use the blood vessels to actually deliver the treatment. This is an alternative, and many of the things we do are alternatives to standard surgical therapy, and this is, in many of our procedures, is performed just with local anesthesia and some sedation. So if you remember at the beginning of the talk, I talked about how fibroids are very vascular, and you can see the picture here on the left. You see fibroids on the inside of the uterus here, and you see these little branches of blood vessels that actually feed the fibroids. So fibroids like to get a lot of blood, and the reason that there's all this blood going to it is what allows the fibroids to grow. And so how we do the procedure as interventional radiologists is we take a little catheter, which is a slender plastic tube, and we can put it through a tiny nick at the top of the leg into the artery, the femoral artery at that level, and then we take our catheter and we thread it into the blood vessels and then into the arteries that feed the fibroids, as over in here. And then we get the catheter right up to where the fibroids are. We can inject something called an embolic, which is where the word embolization comes from, which is to block something, block blood flow. And we inject that embolic into the blood vessel, and it floats into the arteries that feed the fibroids. And when we deliver it, it just stays there. And when we block the blood flow to the fibroids, now those fibroids don't have any blood flow, and then what happens over here, as evidenced in our little cartoon drawing, is the fibroids shrink, and when they shrink, a lot of the symptoms, especially the bleeding, pain, and everything else, go away. So how do we do this? We need, we have to look inside the body, and here to the left is one of these tables. It's called an angiography suite, where basically there's a special X-ray camera that we can, the patient lies on the table here, and this X-ray camera can actually look into the body, and we can see what's inside the body and navigate our little catheters while looking on the screen, which shows what's happening inside the body. And here, a picture on the right is a picture of just doing just that, where we have this little catheter going in, and we're looking at the monitors while the pictures are being obtained by the live X-rays here. And when we want to see the blood vessels, we usually inject something called X-ray dye or contrast into the blood vessels, and this is demonstrating just that. The X-ray dye is injected through the catheter and it floats into the blood vessels, and here you have a large fibroid, and you see all these squiggly lines here. Those are the blood vessels that are floating around the fibroid, and you can see, like I said earlier, it's very vascular. And what we'll do is we'll navigate that catheter, and here, and this will come in a little later, this will be important because you'll see this is a very nice branch of the artery, and we can thread our catheter nicely into this artery, and then we deliver that embolic, or the agents that's going to block the fibroid. And here we have pictures of the embolic agents that we use to block the fibroid blood vessels. And these are calculated so that we know the exact size based on what we see when we inject the X-ray dye into the patient that we need to use in the patient. And they will be delivered through the catheter to block the blood flow. And what happens, generally for most patients, it's an overnight admission, it's an outpatient observation, they'll stay in the hospital overnight. We do give medications because there's frequently cramping after the procedure, and patients are kept very comfortable until the next morning. They're discharged and they go home just on some oral pain medications. And this here is a very typical picture of what we'll see on a patient who's had an MRI pre-procedure. This is a picture of the uterus outlined and a very large fibroid in here, and this 3 months after the procedure, you see how the uterus has not only shrunk down, but that fibroid has shrunk down. And here also you may be able to see we have a bladder that's totally compressed. That patient had urinary frequency, and now here's a bladder over here that's not compressed, and so the patient's urinary frequency also goes away, as in this case. And here also demonstrating after the embolization procedure that you see the arrow pointing to the 3 different fibroids there, and several months after the procedure, the fibroids are, as well as the uterus, are all shrunken down. So This is not a new procedure. Uterine fibroid embolization is something that interventional radiologists have been performing for the past 20 years. There's been a lot of extensive research on both the procedure, how to do the procedure, as well as the different agents or embolics that we use. And really everything we use related to this procedure is FDA approved and shown to be quite safe, and we've had some excellent long-term outcomes. So rather than dazzle everybody with all the different medical research that's been done, I compiled a slide here that really gives the whole story to patients, which is we see between an 85 and 90% short-term improvement or complete cure of symptoms related to fibroid after this procedure. When we look long-term, and we're able to say this now, over 80% of patients 7 years out from the procedure have success and have not had recurrence, and that number doesn't change too much at 10 years. We've seen that there's an equal quality of life improvement to hysterectomy in a lot of excellently done medical trials. And really there's been a lot of articles that have shown excellent success and safety, and for sure, because this is a minimally invasive procedure, a lower complication rate than most surgeries, certainly hysterectomy and myomectomy.